Hello everyone, my name is Maliha Hokshima. Today I am going to talk about surgical anatomy of maxillary artery. The maxillary artery, the larger of the two terminal branches of the external carotid artery, which arises behind the nape of the mandible and is at first embedded in the substance of the parotid gland. It passes forward between the ramus of the mandibular ligament and then runs either superficial or deep to the lateral pterygoid muscle, to the pterygopalatine fossa. I'm going to briefly talk about the overview on carotid arteries, introductions of maxillary artery, the course of maxillary artery, the branches, and some surgical terms. Overview on carotid arteries. The carotid arteries are the major blood vessels in the neck that supply blood to brain, neck, and face. There are two carotid arteries, one on the right and one on the left. In the neck, each carotid artery branches divide into two, the internal carotid artery and the external carotid artery. The internal carotid arteries supplies blood to the brain. The external carotid artery supplies blood to the face and the neck. The common carotid and internal carotid are slightly dilated in an area known as the carotid sinus and is a baroreceptor that reacts to changes in arterial blood pressure. The artery ends within the parotid gland by dividing into the superficial temporal artery and the maxillary artery. Introduction. Maxillary artery is one of the two terminal branches of the external carotid artery. It supplies blood to maxillary and mandibular bones, deep facial areas, cerebral dura mater, and the nasal cavity. Main tracts divides into three parts. Mandibular part. It winds around deep to the neck and the mandible. Pterygoid part. It travels between the two heads of the lateral pterygoid muscle. Pterygopalatine part enters into the pterygopalatine fossa. Course of maxillary artery. The maxillary artery at its origin is embedded in the parotid gland. First part runs horizontally between the nape of the mandible and spinomandibular ligament on the lower border of the lateral pterygoid muscle. Second part runs superficial to the lower head of the lateral pterygoid muscle. Third part runs medially between the two heads of the lateral pterygoid and ends in the pterygopalatine fossa and terminates into the spinopalatine artery near the nasal cavity. Branches and distribution. Mandibular part. Deep auricular artery. Superficially to the tympanic membrane, passing between the cartilage and bone to supply the external acoustic meatus. Anterior tympanic artery. It passes deep to the membrane through the petrotympanic feature to the middle ear to join the circular anastomosis around the tympanic membrane. Medial meningeal artery. It ascends between the two roots of the auriculotemporal nerve through foramen spinosum. It runs forward in a groove of the greater wing of the sphenoid bone and divides into two branches, anterior division and posterior division. Inferior alveolar artery. The artery runs along the canal accompanying the nerve and divides near the first premolar, giving of incisor and mental, near the origin of linguinal and myohyoid. Accessory meningeal artery. It passes upward through the foramen ovale to supply the dura mater of the trigeminal cave. Parotid part. Mesenteric artery accompanies the linguinal nerve. It is small and passes laterally through the mandibular notch to the deep surface of the masseter muscle, which it supplies. Pterygoid artery. It supplies the lateral pterygoid muscle and the medial pterygoid muscle. Deep temporal artery. They course between the temporalis and the pericranium respectively, supplying the muscles and the anastomosis with the middle temporal artery. The anterior division communicates with the lacrimal artery by means of small branches which perforate the zygomatic bone and the great wing of sphenoid. Pterygopalatine part. Spinopalatine artery. It passes through the spinopalatine foramen into the cavity of the nose at the back part of the superior meatus, crossing the inferior surface of the sphenoid. The spinopalatine artery ends on the nasal septum as the posterior septal branches. Descending palatine artery. It descends through the greater palatine canal with the greater and lesser palatine branches. It emerges from the greater palatine foramen, runs forward in a groove on the medial side of the alveolar border of the hard palate to the incisive canal. The terminal branch of the artery passes upward through the canal to anastomose with the spinopalatine artery. Posterior superior alveolar artery gives numerous branches that accompany the corresponding nerves through foramina in the posterior wall of the maxillary, supplying the molar and premolar and the lining of sinus and gums. Pharyngeal artery. It runs backward through the pharyngeal canal with the pharyngeal nerve and supplies structures such as the pharynx, the posterior aspect of the roof of the nasal cavity, sphenoid sinus, and Eustachian tube. Artery to the pterygoid canal. It passes backward along the pterygoid canal and supplies the upper part of the pharynx, auditory tube, and send a small divisions into the tympanic cavity to anastomose with the tympanic arteries. Maxillary osteotomy. Maxillary osteotomy is an operation in which the surgeon makes an incision in the gum through the maxilla above the teeth. The operation does not involve any incision on the face. Lefort first osteotomy. The Lefort first maxillary osteotomy is the most common surgical procedure to correct dentofacial deformities involving the maxilla. The surgical cut goes through the wall of the maxillary sinuses, lateral nasal walls, and the nasal septum at the level just superior to the apices of the maxillary teeth. Surgical assisted maxillary expansions assist to correct deformities in transverse dimension, first described by Angel in 1860. This procedure is in essence combinations of distraction, osteogenesis, and controlled soft tissue expansion. Lefort second osteotomy. The Lefort second osteotomy is a procedure that can simultaneously correct nasal and occlusal deformities, leading to improvement in a patient's oral function and facial aesthetics. It is a pyramidal osteotomy. It differs from the Lefort first that it passes anteriorly toward the orbit. It is used mainly with CLP. The Lefort 3 osteotomy. The Lefort 3 osteotomy is used to correct generalized growth failure of the midface involving the upper jaw, nose, and cheekbone. It is used for the corrections of systematical midface recession affecting zygomatrico-maxillary and orbital region. Thank you so much.